Welcome, everybody. Just admitting people into the chat room. If I could get a thumbs up or a wave just to know that our audio is working, that would be fantastic. Thank you, Linda. I appreciate that. We'll just wait another minute and we'll get going. Okay, perfect. Well, we'll just get on with things. Welcome to our webinar this evening. Thank you so much for taking the time to join us. We're pretty excited about this one. It's a basic understanding of nerve pain with Dr. Evan Steinke, who is the webinar champion of AST. He always has so much wonderful information that he loves to share. So I trust that you will enjoy what's coming at you. And yes, without further ado, I'm just going to pass it on to Dr. Steinke. And once again, thanks for your time.
Perfect. Thank you, Renee. Okay, well, thanks so much for coming, everyone. And like she said, today we're going to cover a bit of the basics of nerve pain. And hopefully by the end of this, we have a better understanding of what exactly it is, what the conditions are, and how it's all functioning. So just a little bit about me and my qualifications. I have a Bachelor of Science in Human Biology from the University of Western States, and I'm also a Doctor of Chiropractic. Also did a couple of years at U of C doing a biomedical program as well. So I wanted to talk today about nerve pain and frame it in a way of patient symptoms, right? I think the first thing people experience, or the first time they really think about nerve pain is because they've experienced it, right? So we're going to start with what are the symptoms that you might be experiencing, and then we're going to go into, well, what condition, what disease might be causing those symptoms. And then from there, we're going to go into kind of the how of it. How does that condition cause my symptoms? What's basically the underlying anatomy? What's going on there? So if we talk about what the presentation of nerve pain is, also known as neuralgia, that's the medical term for it. Neuralgia is the pain often along the path of the nerve, and it's typically described as a sharp, a shooting, or stabbing pain. And this kind of speaks to the severity of it. You know, typically you wouldn't describe like a 1 out of 10 pain as stabbing, right? It's kind of higher on the pain scale. And when people say shooting, it's because it can almost travel down the nerve. So people also describe that as like electrical shock like, or like I had a zing down my leg. So depending on the length of the nerve, it could be all the way from your middle back down to your toe, right? That kind of quick shooting sensation. And that's a bit of a testament to how fast nerve signals travel, right? It's over within a second. And sometimes less often, but sometimes people describe this also as a burning sensation. Usually more in the extremities. People might say, well, it kind of feels like my hand is burning, even though, you know, it never, you know, touched the stove or anything like that. It's just a symptom that they might experience. Um, I will say though that if you're experiencing sharp pain, it's not always nerve pain, right? This is one of the signs, but it doesn't mean that every sharp pain you experience is from a nerve. Some people describe, for example, joint pain is also feeling sharp. So I just wanted to mention that. Other issues that you might feel that aren't under the pain category, but still are signs of nerve issues are under the umbrella term neuropathy. This could be something like numbness, tingling, or pins and needles. They're all pretty much describing the exact same experience or sensation that somebody's feeling, but people use different vocabulary, right? So that kind of like your arm fell asleep, that kind of numbness, that can be a sign of a nerve. The second thing that you might experience is a weakness. This is interesting because it kind of slides on the severity scale as well. So for example, if you were in a car accident and the something, you know, cut a nerve in your arm, say, then you could send the signal to contract your finger, but the signal never made it there. The nerve was severed, right? And in that case, you know, your finger is weak, even though technically the muscle's okay, the signal never made it. On the other end of that scale, it could be, well, the nerve wasn't completely cut, it was just damaged, right? And maybe instead of all of the muscle firing, only bits and pieces, only some of those nerve or muscle fibers are firing. So it's not at full strength anymore. So that might display as weakness. This can lead to something like muscle atrophy, which is essentially, you can think about this as like a bodybuilder, right? They build up their muscles, they have lots of mass around, their bones. You can see the muscle mass, and then for whatever reason, they stop working out. The muscles aren't getting stimulated by the nerves as much, and what happens is the muscles start to shrink, right? And they're getting smaller and smaller. This can happen in car accidents and other injuries as well, where the muscles kind of essentially they wither and they waste away, they get smaller. So that can be another sign. Three would be loss of sensation. Pretty much every sensation that you feel. It could be touch in your fingers, vibration. It could be your taste, your smell, even your vision, right? All of these are relayed to your brain through nerves. So if you lose one of those sensations, we have to look at, okay, was there nerve damage somewhere along the way? And then number four is something that, it doesn't always get thought of as a nerve issue. It's incontinence, right? So um, the nerves that supply the muscles, like the sphincters that keep all of the fluid in our bladders, they are relying on those nerves to keep them closed. If you were to say have an injury like a nerve damage through a herniation, and that nerve is no longer firing properly, you can't keep the sphincter closed. And then when the fluid comes, it just leaks out, right? And that's essentially what incontinence is. So sometimes if you ever get asked these questions, what we're looking for is, okay, was there more than nerve pain? Is there other signs of nerve damage? So that's basically what you would experience in terms of symptoms. But what conditions might cause these? Well, the probably the most common one that we see in the clinic and we get told about a lot is sciatica, right? People come in, they're saying, I'm experiencing pain down my leg, I have sciatica. The only issue I have with this is it's more of a symptom than it is a diagnosis because sciatica in itself just means pain of the sciatic nerve, which I've highlighted here. That's what the image is, right? So the yellow bit is the nerve and the red is the area that it affects. So if you're having sciatic pain, it could be anywhere down the back of your leg all the way to your toe. What I really want to know though is what's the underlying condition that's causing pain in that nerve, right? So I listed two possible causes here. So piriformis syndrome would be one of them. It affects the sciatic nerve. And I have a picture of what your piriformis is. It's a muscle that runs right down kind of in the glute region. It runs from your sacrum out to the edge of your hip. And when there's this zoomed in picture here, where the muscle basically can squeeze that nerve right up against the bone. In some cases, the nerve actually goes right through the muscle belly itself. So you can imagine that the tighter this muscle is, the more pressure you're getting on that sciatic nerve. So it's kind of more the underlying cause, kind of the true diagnosis of what's causing the pain. Other things like disc herniations, depending on the location, can affect various parts of your sciatic nerve as well. So other conditions like carpal tunnel syndrome, this one we see pretty frequently as well. This affects a very specific nerve called your median nerve. It runs right down the middle of your arm into your hand, and it supplies some of the muscles. It also supplies the sensation of the skin. So the part highlighted in blue, the first three fingers and half of your ring finger are supplied by this nerve. So if you were to get symptoms, you might experience pain in that area. Also, you might feel like the muscles are feeling weak, like you can't squeeze a pen as hard as you used to. Maybe you're dropping stuff more often. People often end up shaking out their wrists because they're getting numbness and tingling in that area. Diabetic neuropathy, this is a really interesting one because up to 50% of diabetics can experience some form of nerve issue, right? And what's really interesting about this is it's not a specific nerve. Like all the other conditions I've mentioned, wherever it's pressing on a very specific nerve. Diabetes is a systemic condition. right? So it's affecting your whole body. So essentially, you have unregulated glucose throughout your blood system. It's getting pumped throughout the body. And the nerves that are most vulnerable to that are usually very far into the fingertips or into the toes. So you get something called glove and stocking distribution, which is what's highlighted here. So that could be feelings of like, I have gloves on even though I don't, or I have stockings on and I don't. And what's also interesting is it's both sides. It's not always, but it can be both sides. Whereas those other conditions I was talking about, it's almost always just a single nerve. So it's just one side of the body. In this case, it could be both. So that can also affect multiple nerves, right? Any nerve in the fingertip, it can start to affect. Another condition we see, it's got big fancy names, but neuralgia paresthetica is essentially a nerve called the lateral femoral cutaneous nerve that runs out from your low back and it innervates the side of your thigh, right? So it's supplying the skin with its sense of sensation. And what can happen is it gets pinched underneath your inguinal ligament, which is that white line you see here right across the groin line. So you could imagine that people that sit a lot, like I think of dentists or hygienists, people that are kind of like leaning over patients, constantly stuck in those positions for sometimes long periods of time, they're really compressing on this nerve. Okay, so similar to carpal tunnel, it's a direct pressure, and that will cause pain, numbness, tingling to the outer thigh. So those are some of the common conditions we see. But if we want to get into like how does this actually cause our symptoms, right? That's the condition. How is it happening? We have to understand a little bit about how nerves work. So here's a picture of a neuron, and I'm just going to go over it briefly. On the left side in that orange structure, the cell body, that is where the signals start to get received. It has all of these branching off things called dendrites, but essentially what those do is they reach out to either like sensory receptors. You can think of like a pressure receptor or a taste receptor, or even other neurons. And it collects all of these signals and they accumulate in the cell body. And once it reaches a certain threshold, it fires. It sends the signal down and it goes down what's called the axon, this long little thin bit in the middle, and it reaches the far side and it triggers another cascade, depending on whatever it's connected to. That axon can be short. If it's in the brain, it's just jumping from neuron to neuron. It could be really long. It could be, again, from your middle back all the way down to, a toe or something, right? So it depends on the nerve, but various anatomy, but more or less, that's how they work, right? And if we review this a bit with a GIF here, this helps make sense of it. So the blue neuron is passing on a signal to the purple neuron. And you can see that the white signal comes down, it's transferred through those dendrites, and it accumulates in the cell body, right? So right before this dark purple bit, you'll see that 4 signals are required before it sends. So 2, wait, wait, wait. And once all 4 get there, the threshold's met and it fires. Now, depending on what's on the other end, different things are going to happen. If it was a motor neuron, like you can see in the middle here, it's hooked up to a muscle fiber. So when that fires, it's going to contract the muscle. If it was hooked up to a sensory cell, say it was like a pressure receptor in your finger, right? So you feel a deep pressure on your finger, that triggers the cell sends the signal to your brain and goes, oh, I just had a deep pressure on my left index finger, right? So the brain can start to interpret what what cells or what neurons are firing. Okay, so motor neurons attached to muscle fibers, and sensory could be anything from touch, sound, smell, taste, anything like those. So where does this go wrong? Where does this lead to nerve pain? Well, nerve pain can be caused by either a disease or an injury to those cells. So in the case of something like diabetes, it's a disease, right? In diabetes, what happens is the blood vessels that support and give nutrients to the nerves start to wither and they can get destroyed. And again, the most sensitive areas to that are the ones in the fingertips and the hands and into the toes and towards the foot, right? They're the most sensitive to diabetes, right? These changes in the blood glucose. So once those blood vessels start to die, the nerve isn't supported anymore. It can't get its nutrients, and even the support cells can't get the nutrients to keep the cell alive, and the nerves start to either get damaged or completely die off. And when that happens, you now have things like the nerve pain or the neuropathies, the numbness, the tingling, the sensations of weakness. All of those can happen. On the flip side, if it's not a disease, it might be a direct injury to the cell. So if we think about something like the carpal tunnel syndrome, where the nerve is passing through quite literally a tunnel, right? You can see it on the right side here. On the bottom, you have all of these bones blocking the bottom side. And on the top, you have this white piece of connective tissue called the transverse ligament. And essentially what that does is it makes a tunnel with a finite amount of space. And if there's an injury to that area, if there's inflammation in there from your repetitive use of it, it's starting to swell up, you're getting tendonitis, all of that is starting to restrict the amount of space in there, and you're getting a physical compression on your median nerve that travels through there, and that's going to lead to that tingling and that pain, right? So just to recap, you get the either a disease or a trauma and injury to the nerve, and that's what's triggering the actual nerve pain. So what can we do about it? Well, there's lots of different treatments, but treatment always starts with a good history and a good physical exam, because we have to know what nerve is being affected and why it's being affected, right? So if we go back to sciatica, why are you getting sciatica? Is it the piriformis syndrome where that muscle's too tight? Because if that was the case, then active release technique, which is something that our clinic does very well, like all of our chiropractors are trained in this, we can release that muscle, right? So essentially what we do is we shorten it up, we pin it down, and we stretch it out. We really dig in there and we release the tension in the muscle. And what that would do is free up space for the nerve, so it's not being compressed so hard anymore, okay? Um, Active release technique would not be viable for somebody with, say, the diabetes, because that's a disease condition where, I could stretch the muscle over and over, but that's not the cause of your pain. So that's where I'm wrapping back to getting a good history, getting a good physical exam is the first place for addressing nerve pain. Other things that we can do in office are adjustments or manipulations. Same thing. This really helps in chronic nerve pain. What's interesting about chronic nerve pain is there's evidence to suggest that that threshold I was talking about, in this case, in this particular one, it takes 4 signals for it to fire. That threshold can get lowered in chronic pain. So say it went from 4 down to 2. With only 2 signals, it's going to fire more often, right? And you're going to be experiencing pain more often. So there's some suggestions that adjustments can help increase that threshold. Let's say it goes back up to 4. So if you got 2 signals in, it's not enough to send the pain signal to the brain anymore, right? So that's where adjustments and manipulations can really come in, especially with chronic nerve pain, which can be really debilitating for people. In terms of mobilizations, this can be for things like pinched nerves. So I'm thinking like a herniation is a really common one, where basically some of the fluid from inside of a disc is bulging out. You can see it. It's compressing right up against the nerve where it should have free movement, and it doesn't anymore. So mobilization is where I move the joints and the surrounding tissue to free up space so that nerve isn't being compressed so hard, and it can relieve the symptoms. And this really easily translates into homework, right? So these could be like flexion techniques. So for example, if flexing forward of the spine helps relieve patients' pain, I'm going to encourage them to do exercises or certain stretching techniques that emphasize that flexion component. And then other things that we can do are stuff like biomechanics. And this one wraps back to that neuralgia parasitica. If the issue with your nerve was a compression of it, what we would want to do is help relieve that. But if your job is like a dentist, you're going to have to keep doing it. So could I change the way that you're working? Could I, get you to use a different stool? Could we get those glasses that, you look forward and then they bend the light down so that you can kind of look straight ahead and sit upright without having to lean so far forward? Can we take little breaks so that the compression isn't so long? All of these things get addressed, right? Changing people's mechanics and the way that they're approaching, whether it's their job or their hobby, becomes really important. And that also does trail over into home care that we provide for people. So let's talk a little bit about like what can people do at home? Is there anything? And the answer is yes. Various exercises and stretches go a long way to helping nerve pain. Depends on the condition and the nerve, right? So the first one I'm going to talk about is nerve flossing or nerve gliding, two different names for essentially the same process. And it's pretty straightforward. And I'm going to walk people through an example. So we talked a little bit about carpal tunnel syndrome and the nerve that affects, which is called your median nerve. And ways to stretch that are like in the image here that you see. So I'm going to have everybody kind of follow along and see if you feel a stretch with me. Okay, so we're going to copy this image. So let's use our right arm. I'm going to put our left hand on our right shoulder. We're going to kind of let it sink down. You're going to reach out with your right arm so it's all the way out, fingers pointing straight ahead, okay? Then you're going to slowly bring the fingertips back towards the wall, or you can drop them down towards the floor, whichever way works for you. You might start to feel a pull into the palm. You might feel numbness or tingling in the fingertips. You might even feel it by the elbow. It depends where you're feeling the tension, right? So what we would recommend in clinic is if you're feeling that, we would want to back off with the extension of the wrist to start to bring it forward again and just until the pain stops. So for me, it's about here. So about halfway. I can still feel just a smidge, but not much. And then what I would do is from this position, I'm going to lean my left ear to my left shoulder. And that should bring the stretch back. You should instantly feel the symptoms come back. And if not, go back to neutral position and increase it a little bit and try again until you feel it. And when my head is in the neutral position, I don't feel anything. So that would be one repetition from here to there, right? So it depends on people's conditions. Some people feel this only on one arm, some people feel it on both. But typically we recommend doing about 10 reps of this, and it can be up to 5, 10 times a day even that we recommend that. So the idea here is that we're literally like flossing or gliding the nerve back and forth, right? We get it right up to the edge of tension, and then we add a little more by leaning away, and we're sliding the nerve back and forth. So anything that's adhering to it, we're trying to break free of that, essentially. So that's a really great way to start with home care. The other things to address are things like diet changes. So if we were talking about diabetes, for example, type 2 is controlled through exercise and diet. So that's something that we can walk you through. We can always refer as well. We have dietitians at Active Sports Therapy that can help you through good ways to approach diet changes. That isn't always the case with, say, for carpal tunnel, a diet change isn't really going to affect there. So again, comes back to what exactly is the cause of your nerve pain. 3 would be stuff like lifestyle. So this would include exercise components. So for people that are experiencing, perhaps muscle weakness, we might want to strengthen certain muscles. If it comes back to that piriformis syndrome, we might want to release it with various stretching techniques. Yoga, for example, people start to incorporate that throughout their weekly routines. And then this also ties back into the biomechanics. Did your job kind of start this off? Can we change something in your job? Are you a chronic sloucher? Do you have poor posture? Right? We need to start to address the root cause of your condition. And if that means changing your postures and certain things about your lifestyle, then we'll have to do that as well. And then fourth is just stretching, right? So again, things like this condition where the muscle's too tight, it's literally compressing your nerve. We might release it in office with active release technique. But what we would need to do is keep it loose. So at home, I'm going to give you stretches to maintain that. Stuff like this. This is this position here that the woman's performing is called figure 4. It's really great. It gets into your glutes. It gets into that piriformis muscle. It gives it a really good stretch. And we usually recommend, even if you're only experiencing it on one side, always do stretches for both sides. So that would be how we can include home care in the kind of nerve pain process of recovery. So if we just do a quick overview of what we've kind of learned so far is we know now how neurons work, right? They're messengers. They relay messages from either a sensory tissue like a deep pressure or a sense of taste or smell. And they relay that to the brain, or it's kind of vice versa, where the brain is telling a muscle to contract. Now, depending on what's happened, if it's an injury or a trauma, you can get your neuropathies, for example, say carpal tunnel syndrome, where you're getting the numbness, the tingling, the pain into the hand. Or if it's a disease, you're going to get something like diabetes. There's other conditions that can cause this, thinking really common ones like multiple sclerosis, MS, or Alzheimer's. These are all neuron diseases that can also lead into neuropathies, right? And again, the neuropathy is the umbrella term. That's anything like numbness, tingling, weakness, the loss of sensation. And then you have your neuralgias, which are going to be the specifically nerve pain, right? The sharp, the shooting, the stabbing like pain, the electrical or shock like. So that's kind of a review, right? So how the nerves work, what conditions they cause, and what symptoms you're ultimately going to experience from them, and a little bit about some of the stuff that we can do in office for you, as well as stuff that we can give you to take home to help treat those conditions. So here's a little bit of the references, and I would like to open it up. If people have questions for me, please let me know. I'm more than happy to answer anything to the best of my ability.
Thank you for that information, Dr. Evan. One of the things I noticed when I stretched my arm is how tingly my
Yeah,
are.
yeah.
And that's something that is common at nighttime. Is that linked to nerve pain? Like, say I'll wake up in the middle of the night and my hand's tingly. Is that something that's linked to
Yeah, so
pain?
that's a great question. So, kind of like what I was saying before, where how sharp pain can be a sign of nerve pain, but it doesn't only mean that. Numbness can be a sign of nerve issues, but it's not always nerve. So tingling sensations can happen from nerve, but it can also happen from lack of blood flow. So people, when they're sleeping, it's pretty common that sometimes they'll fold their wrists in and they'll leave them there for a long period of time. That restricts not only the space for the nerve, but it can also restrict the amount of blood flow that can get to that area. So it would be a matter of kind of determining, is this kind of a cardiovascular issue or is this a nerve issue? Both of those would respond to kind of straightening of the wrist, though. It would let more blood flow through and leave a bit more space for the nerve. So for stuff like that, we often would recommend, like a night brace and just see what happens with that. If you can wear something that keeps your wrist in a straight position, and go from there. But definitely something that you'd want to look into. Yeah.
Thank you.
Mhm.
Are there any other questions out there that have come up? I think you went back to that reference page. Thanks for that.
Yeah.
Yeah, I have a question.
Yeah, what's up?
I had a cyst on my lower left spine,
Okay.
which was removed with surgery.
Okay.
But I still get pain there quite often if I stand for too long or if I
Okay.
walk too far. I
Mhm.
really feel the pain in my in my glute and my leg. I'm just
Mhm.
wondering if if you have anything that would help with that.
Yeah, so the pain that you're experiencing, is it mostly there or does it always kind of go down into the glute, down the leg,
No, it's mostly in my lower back and my
lower
glute.
back?
Doesn't go
Okay.
down my leg.
Okay.
Yeah,
Yeah, so what's interesting about a cyst, right, is it's a space occupying lesion. So it can initially press on the nerve, and when you get it removed, there can be damage to the surrounding structures that
right.
may or may not be permanent, depending on the case by case of the surgery. the place to start would be to see, how much compression is there still on that nerve. So looking at, for example, maybe an X-ray or an MRI to see what's still going on. And then it would be a matter of, okay, there is compression. Let's work on releasing it through the mobilizations or the adjustment techniques. Or maybe in the surgery, they actually damage one of the nerves, in which case you can't necessarily regrow that with conservative care. That's not going to happen, but we could try to manage the symptoms at that point. Strengthening the surrounding area so that the joints aren't collapsing too close to the nerves, that sort of stuff. So I'd
Right.
recommend, that's a pretty specific case. I'd need more information to really dive into it.
Right.
But it would be worth following up to see if you could get help with that. Yeah.
Okay. All right. Thank you.
Yeah. Oh, I think there's a written question. It says, how does a person decide best type of specialist, physio, chiro, etc., to treat their ailment? Excellent question. Again, if I knew more, I could kind of point you in the right direction. But just as a broad overview, chiropractors are muscle, joint, and nerve specialists. That is what we really, really focus on. So if it's a muscle pain or soreness, if there's a nerve involved, it's a great place to start. Likewise, physiotherapy overlaps a lot with us. They are a little more into the kind of rehabilitation side of things. So if it's pre or post surgery that's the issue, they would be great choices for, getting you a exercise and rehabilitation program. They might not be as hands-on as a chiropractor. They're not going to do the adjustments, but a lot of them do things like needling as well. So it kind of depends. If you ever call our clinic, the front desk is usually pretty good at pointing you in the right direction, depending on some of the things that you're experiencing. I hope that helps. If you want more, let me know.
That's great. Any other questions that may have come up? I think that's probably a wrap. Dr. Evan, your information is always so valuable. Thank you for the clarity in which you describe pretty complex things. I know I always appreciate it, and I hope the audience does as well. Just making sure that wasn't a question. I think that's all. So yes, thank you so much for your time on this somewhat beautiful evening. If you have any suggestions of what you'd like to learn a bit more about, whether it be along the lines of nerves or nerve pain, sorry, feel free to leave some feedback in our feedback link that will be sent with the playback tomorrow. That's always very informative for us. If there's a topic you'd like to hear more about, we are open to sharing lots of information. You can find Dr. Evan Steinke at Westman Village. Are you working there full-time?
Yeah, I'm there full time. Yep.
Yeah, full-time at Westman Village. The information is all on the screen, but if you're on our website, you can always click on the Westman Village link, which will lead you to how to contact or book in with Dr. Steinke. I think that is all. One more huge thank you for everyone's time and attention. And thanks again, Dr. Evan, for everything that you do.
Perfect. Thank you.
Have a great night, everybody. Bye.